Hi, my name is Deanna Harris, and this video is for Nursing 224 Wound Care. I am going to do steps 21 through 28. I've already asked permission from the patient to change the wound care dressing. I've already educated the patient as to the reason why we needed to change the wound care dressing. I've already taken the old packaging off and assess the wound for coca, assess the wound for eschar and tunneling, and I've already have my PPE on. The next step is to don my sterile gloves and go ahead and change or irrigate the wound and clean the wound and put new change on it, new dressing. So here is my sterile field here. Here is my wound here. Here's my clean area, and here is my container here. Here's my tray, my dressing tray. So first I'm going to open up my tray, and I'm going to open it away from me. And since my gloves are in here, I can go ahead and take my gloves out. And since everything else in here is sterile, I can go ahead and put my gloves on. Okay, I'm going to start with my dominant hand. And so I'm just going to take the cuff here, and I'm going to put it on like this. Now this glove is torn. So I do know in a medical facility, if it was torn, I would have to get a new set of sterile gloves. But for educational purposes, and this is the only set of gloves I have, I'll just go ahead and do it this way. And so since this is sterile here, I'll take it and go under here, since sterile can touch sterile, and put this glove on. So now I'm ready. I'm gonna go ahead and remove this, remove the packaging. I'm gonna put my hand here in the middle and move it and put it in the reciprocal and in the proper bin. Next, I am going to, since my container here is sterile, I will go ahead and take my sterile solution out, check the expiration date here, make sure it's not expired, and then I will go ahead and take out at least 35 milliliters of water here and put it in my container, and then I will set to the side. Next, I will go ahead and put some sterile gauze into the solution and let it get saturated. And once it's saturated, then I can go ahead and take a sterile gauze from my sterile hand and put it in my clean hand. And then I'm going to irrigate the area in one direction. And as I am irrigating, I'm checking for the drainage, the color of the drainage, to turn clear. Once it has turned clear, I will let the patient know that the drainage is now clear. I will throw the gauze that I've used in the proper reciprocal there. And then next I will take a dry gauze and place it over the wound. And now I will take a sterile Q-tip. That's sterile Q-tip, And now I will allow it to adjust the packaging, the gauze, to cover the wound. Then I will transfer this to my clean hand and throw that away. Next, I will take another piece of dry gauze and drop it into my clean hand. And now I will go around the edges and dry the outer edges there and throw that away. Next, I will take the pad and I will cover the wound. Then I will take my tape and I will tape the sides down. And then I will take my label and I will label it with my name or my initials, the date and the time that the wound was changed. Once that is complete, I will ask the patient, I'll let them know that the procedure is complete. I will assess them for their comfort level, and then I will go ahead and take off my sterile gloves. So I will take these off. And then I will cut these here. And then I will take it from here. And place them in the proper compartment. Thank you so much for watching my video, and I hope that this helped. Thank you.